ensures privacy. Hello, my name is Taylor. I'll be your student nurse this afternoon. How are you?
I'm alright.
Performing hand hygiene. Okay, can I get your, let me see your wrist. Can I get your name and date of birth, please?
Jacquees Webster, June 2nd, 1998.
Okay. Your doctor has ordered that we do a head-to-toe assessment on you. Is that okay? And do you have any, are you in any pain today? Okay. I'm going to start off with your respiratory assessment. Do you have any tightness in your chest, any chest pains?
I have asthma.
Okay. I'll make sure I'll note that for the doctor. All right, we're going to listen to his lung sounds starting in the right upper quadrant. Can I get one big deep breath? Moving over to the left upper quadrant. Can I get one big deep breath? Moving down to the left lower quadrant. One big deep breath. And then to the right lower quadrant. One big deep breath. Okay, now I'm going to listen laterally. On the right side to that right middle lobe, can you do one big deep breath? And then I'm going to go left side laterally to listen to the left lower lobe. One big deep breath. Okay, I heard clear vesicular sounds anteriorly. I didn't hear any adventitia sounds. His respirations were clear and unlabored. They were eupnea anteriorly. So now I'm going to listen to the right upper lobe. Can you breathe in? Then the left upper lobe, one big deep breath. Then moving down to the left lower lobe, one big deep breath. And then moving over to the right lower lobe, one big deep breath. Okay. The respirations in the posteriorly were clear and unlabored. I didn't hear any adventitia sounds. They were both sides, anteriorly, posteriorly, were eupnea. So since we're in the season of COVID, just in case if you do get sick, I just want to tell you it's always good to do 10 big deep breaths following a cough every hour. So you'll breathe in, breathe out, and then, and that just helps, expand your lungs since we don't expand our lungs on a daily basis. And also, just in case if you did have any mucus or any fluid in your lungs when you cough, it will help expel any of it. And if you cough today and you had any mucus or sputum, we will assess it to see if it was, any weird color or any abnormal smell. So now we're going to move on to the respiratory assessment. Do you have any history of any heart problems, any cardiovascular problems at all? Okay. So I'm just gonna put this stethoscope on your chest and let me know if you have any pain or you're discomforted anyway. So we're starting on the right side in the second intercostal space. Excuse me. I'm gonna listen to the aortic sound. Then moving over to the left side, second intercostal space, listening to the pulmonic. Then third, listening to Erb's point. Then moving down to the tricuspid, listening in the fourth intercostal space. Okay, and now I'm going to listen in the mid-clavicular line, fifth intercostal space, to his mitral sounds. Okay. Heart sounds were clear, rhythmic. I heard S1 and S2. I didn't hear any abnormal sounds or any sounds that made me think he has any murmurs. Okay, now I'm gonna see your finger. Check for capillary refill. Less than 3 seconds, so that's good. And while I'm up here, I'm just gonna go ahead and name his upper extremity pulses. So you have the radial pulse, brachial pulse, axillary underneath the armpit, and then the carotid in the neck. And can you lean back for me, all the way back, and then turn your head that way? Okay, and turn your head that way. There's no JVD on either side. Okay, you can lean back up if you want. Now I'm gonna check for edema in his right arm. No edema. And then check in the left. No edema. Okay. Now I'm gonna check down here and listen to his dorsalis pedis pulse. which is about a 3+. Listen to the posterior tibial pulse, which is a 3+. Now I'm gonna listen on this side, on the left, to dorsalis pedis pulse, 3+. And then listening to the posterior tibial pulse. Okay, so 3+. Now while I'm down here, I'm just gonna check for edema. No edema in this leg. No edema. Also, the popliteal pulse is behind his knee. The femoral is a little crease when you sit down. That's the femoral pulse. Okay, and that was the cardiac assessment. So there was no edema, pulses were strong. And now we're gonna move on to the musculoskeletal. I'll go ahead and do the musculoskeletal. So do you have any limited range of motion in any of your joints that you know of?
Just my right shoulder.
Okay, and what happened to your right shoulder?
Just a football injury.
Okay, so make sure not to assess that joint. Just make sure you don't overexert yourself to cause further damage to that joint. Okay, so now I'm going to start with the right elbow. Okay, can you bend your elbow forward, like flex it? Okay, then extend it. Okay, can you do it again against my resistance? And do it again. Okay, now just flip your hand. Okay, can you flex your wrist like this? Then extend it like this. Then hyperextend. Okay, do it one more time. Do this. Then do this. And then, okay. And the right arm and the elbow and the wrist, I didn't hear any crackles or popping. You have full range of motion in both of those extremities. So now I'm going to do this side. Okay, can you flex? Then extend. Okay, do that one more time. And then do it again. Okay, now flip your wrist. And do this. Flex, extend, hyperextend. Okay, flex your flex it again. Okay, extend, then hyperextend. Okay, likewise for the left side as well. I didn't hear any crackles or pops. He has full range of motion in both his wrist and elbow. So now I'm going to check the lower extremities. Can you uncross your legs, please? Okay, now can you extend your leg, then flex it? Okay, do flex, extend it, and then flex. Okay. Now lift your leg up a little bit. Point down, then bring it back up. Okay, point down again, and then bring it back up. Okay, he had good range of motion in his knee. He could flex and extend, and also in his ankle, he could dorsiflex and plantar flex. I didn't hear any crackles or popping. Now we're gonna do the same for the left side. Okay, can you kick your leg out? Extend, okay, bring it back in. Flex. All right, do it one more time. Extend, and then flex. Okay, I'm gonna do the same thing with his ankle. Okay, point. Okay, and then bring it back. Point, and then bring it back. Okay, I did hear a slight popping in the ankle from when he did dorsiflex and plantar flex, but other than that, he had good full range of motion in both his knees and ankles. Okay, can you stand up for me? And can you just walk to the table? And then walk back and sit down. Okay, he had a good gait. I didn't see any abnormalities. I didn't have any reason to check for his balance, but if I did want to check, we can do 2 tests. One is called the Romberg's test, which means he'll stand feet together, hands together, closed eyes, and I'll put both of my hands on each side of his body, and if he's swayed, that's a way we can check for balance. Or I can do tandem walking, which is, heel to toe walking, but I had no reason to assess that. So now we're going to move on to the assessment known as HEENT, and that's head, eyes, ears, nose, and throat. So look at you now, your head is asymmetrical, normal cephalic. Do you have any history of head traumas or head injuries? Okay. With hand hygiene, and if I did have gloves on, I'll wear gloves. I'm just going to palpate his head, and I'll see, any abnormalities, any scars, bruising, or anything of the sort. Do you have any eye problems? Do you wear contacts or glasses?
Yeah.
Do you wear both?
Mm-hmm.
When's the last time you went to the eye doctor?
Last week actually.
Okay. Well, looking at your eyes, the sclera is white, which is good. I don't see any, inflammation. We're gonna do a test known as PERLA. It just makes sure that your pupils are equal, round, and reactive to light, and they accommodate. So I'm just gonna shine a light in your eye, and the light that I shine eye into should be 100% constricted, and then the opposite eye 50% constricted, and vice versa. And I'm just gonna do that. Okay. Okay. So both eyes are round and react to light. And now I'm just gonna check to make sure they accommodate. So can you look at just only move your eyes and not your head. Look at my badge and look at the TV. Badge, TV. Okay, they accommodate, so they're PERLA. Also, I noticed your ears are, normal for your head size. The top of your ear auricle lines up with the eye canthus. And I know to do that is just draw an imaginary line from top of your ear to the eye, and it should go together. Do you have any, any history of, ear issues, hard of hearing, or anything of the sort?
Mm-hmm. I have smaller ear holes.
Okay. When's the last time you visited your doctor?
The last month.
Okay, well, that's good. Assessing your ear, I don't see any abnormal secretions or anything, and you seem fine hearing me right now as I'm talking to you. Your nose is midline with your face. Do you have any history with sinus issues or anything of your nose, any cloggedness or anything of the sort?
Just bad allergies, but that's it.
Can you close one nasal and then breathe out the other one? And do the same thing on the other side? Okay. And now I'm just going to check your throat. So I will need you to, I'm going to check your oral mucosa. Can you open wide? Wider? Okay. Oral mucosa is pink, moist. Your tonsils are inflamed. I didn't notice any tooth decay or anything. And so now I'm going to assess your trachea to make sure it's midline. Okay. Just going to give you this imaginary cup of water. And I want you, once you swallow, I'm going to put my hands by your trachea just to make sure that it's midline. So can you fake swallow? Okay, your trachea is midline. I didn't notice, any reason for you to aspirate or anything. So we just completed your HEENT assessment. So now I'm going to do a neuro assessment, and it just means ask you a couple of questions. And so, do you know where you are right now?
Mm-hmm.
Where?
Your house.
Do you know why you're here?
Helping with the video.
And do you know who our president is?
Joe Biden.
And do you know what day it is?
Friday.
Okay. So he was AAO times 4, which means awake, alert, and oriented in person, place, time, and orientation. And just in case, I'm going to tell you about another test we do called the Glasgow Coma Scale. And that's what we use in patients who are unconscious. And so that just means if you have a score less than 8, that means that you have some severe brain damage. And you want to be in a score 13 to 15, which is mild to no brain damage. Okay. And so we did just complete your neuro assessment. Now I'm going to need you to lay down. And now we're going to do your GI assessment, which means we're just going to make sure that everything's going fine with your abdomen and your bowel sounds. And do you have any trouble in history with, stomach pains, abdominal issues, urinary issues? Mm-mm. Okay. And do you remember your last time you used the restroom?
20 minutes ago.
Okay. And did everything seem fine? Urine, was it clear, yellow, dark, or anything?
Clear.
Okay. And did you remember your last bowel movement? Okay. I'll make sure I know that for the doctor. Okay, I looked at your abdomen. It's symmetrical. I don't see any distension, and it's flat, so that's good. So now I'm going to listen to your bowel sounds. You can move your hands for me. All right. I am at the right lower quadrant. Going up to the right upper quadrant. left upper quadrant, and then the left lower. Okay. Bowel sounds were active and normal. I didn't hear, any hyperactive or hypoactive sounds. And so now that I have assessed you and inspected your bowel sounds and osculated, now I'm going to palpate and let me know if you feel any, tenderness, any pain while I'm palpating your abdomen. I'm just going to do a light palpation first. Okay, now we're going to do a deeper palpation. Let me know if you have any pain or tenderness. Okay, now I'm going to listen on my bell sound. And that's just in case if I hear any bruits or any murmurs, because I want to make sure that abdominal aortic, you can have abdominal aortic aneurysms because our aortic valve leads all the way down to our stomach. And that's just in the process of your xiphoid process. And it's right in between your xiphoid process and your belly button. That's where I will listen to for bruits. So just want to make sure. I'm gonna go over all quadrants with my bell side. Okay. I didn't hear any abnormal sounds. You can sit back up. You can sit back up if you want to. Okay. Well, we just completed your GI assessment and you told me you didn't have any, history of any abdominal or bowel or urinary issues. I'll make sure I give all of our findings to the doctor. And do you have any questions for me? Okay.
Thank you.
Thank you.